Hello everybody. నా పేరు డాక్టర్ రఘువీర్ మాచరాజు, కన్సల్టెంట్ యూరాలజిస్ట్ అండ్ ట్రాన్స్ప్లాంట్ సర్జన్, కాంటినెంటల్ హాస్పిటల్స్, హైదరాబాద్. So today I am going to tell a few things about the blood in urine, which is a very common scenario in our population. So blood in urine is technically called hematuria. So for practical purposes, we can see hematuria in two ways. In one place where the patient is having symptoms. So patient will have pain in the flank, he will have blood in the urine, he may have decreased urine output, and he might have sometimes have fever and all. So in those cases, with those symptoms, if patients have blood in urine, even though patient is suffering, usually it is secondary to benign causes like stone or infection. Or sometimes there might be some trauma which might be causing this blood in the urine. But the more alarming situation is when the patient goes for urine and he grossly finds blood in the urine and the situation he is painless. So when he is passing blood in urine without pain, that is a more alarming situation, because that can be there can be underlying cancer in the bladder when the patient develops this type of situation. So any hematuria, whether the patient is symptomatic or patient is asymptomatic, means either it is a painful hematuria or it is a painless hematuria, he has to be evaluated till we find the reason for blood in the urine. So if we find some type of infection or there is some stone somewhere in the bladder or kidney or ureter that is causing blood in the urine, so that is at least the situation is controllable. So it is a benign situation. So it is nothing cancerous about it. You have to deal with either the infection or the stone, and usually the symptom resolves. But the problem is, it's the painless hematuria is the major alarming situation. And sometimes the blood can be there in the urine if there is some type of tumors either in the kidney or in the ureter or in the bladder. So usually the bladder tumors, they will produce blood in urine without pain. But that kidney tumors or the tumors in the ureter, so they will also produce an hematuria, that is blood in urine, but usually they will cause some type of colicky type of pain. So the most important underlying point is, whatever is the once you see blood in urine, it has to be evaluated. So whatever is your age, it's a child, it is the middle age, it is an young adult, or it is an elderly man, and more so in the elderly age group, especially because they are more prone for cancers. So the complete evaluation is mandatory when you find blood in urine, and to find the proper diagnosis, and the investigation has to go on till we find a definitive cause for which is the reason for having blood in urine. So if there is a stone, that has to be removed. If there is infection, that has to be treated. If there is a tumor, that has to be resected. So it is as simple as that. If the tumor is in the kidney, so we need to remove part of the kidney along with the tumor, or we need to remove the entire kidney depending on the situation. If there is a tumor in the bladder, usually 80 to 90% of times we can deal it endoscopically. We will resect the tumor by passing an endoscope through the normal urethra into the bladder, and we will resect the tumor, and that specimen will go to the histopathology or the biopsy. Based on that biopsy report, the further management of the patient will be decided. So whether he requires a major surgery of removal of entire bladder, or he may be followed up with this endoscopy only, can be decided after histopathology. So the catch point and the most important point is, blood in urine has to be evaluated completely, irrespective of the age group, irrespective of the time and situation. So that is the catch home point. Thank you.